So good afternoon, everyone. My name is Adeola, and you're welcome to another episode of Fertility Focus. So I'm talking to you from Clearview Hospital, and today we'll be speaking on the topic post-IVF care. So what is post-IVF care? What is the 2 weeks waiting period that comes after the post-IVF care? What to expect during this 2 weeks waiting period? So like I said earlier, my name is Adeola. I'm a registered nurse and a fertility nurse in Clearview Hospital. So before I start, I'm going to give a brief definition of what IVF nursing is, or what IVF is generally, what the IVF process entails. So what is IVF? IVF simply means in vitro fertilization. Now, in vitro fertilization is just a type of fertilization that occurs outside the woman's body. So now, what is IVF process? Now, the IVF process simply entails the process from the stimulation of the woman's ovaries to produce follicles, and after the production of follicles, the retrieval of eggs from the follicles, and the injection of these eggs that have been retrieved with sperms. Now, after the injection with the sperm, the culturing of this of the resulting ovumes that has been injected with the sperms, the culturing of them in the laboratory to produce an embryo, and then after the embryos have been produced, the transfer back into the woman's uterus. So that's what the whole IVF process, that's what it simply entails. So post-IVF care. What is post-IVF care? Why is post-IVF care important? Why is it necessary? Now, post-IVF care simply means the series of care given to the woman, or the series of things done by the woman after the IVF process, so that as to enhance her chances of achieving pregnancy, a positive pregnancy. So thorough guidance should be provided during this period, because the things the woman does during this period can very well determine whether or not her IVF process is going to be successful, or if it's going to be an utter failure. So, what are the things that the post-IVF care, what are the things it entails? What are the things that she should do to care for herself during the 2 weeks waiting period? Don't forget, the 2 weeks waiting period is that period where that period after the whole IVF process, after the embryos has been transferred into the woman's uterus. It is also the period when implantation occurs. So what are the things the woman is going to see? What are the things she's going to do when she sees these things? So the woman has undergone the IVF process. Embryos have been transferred. The first thing she needs to do is to relax. Okay, relaxation in the sense that she should take things easy. She should not engage in strenuous activities that is going to drain her mentally and physically. Now, by relaxation, she can resume normal activities 24 hours after the procedure, after embryo transfer. Now, it is necessary for her to resume normal activities, because if she doesn't, she might get anxious, and anxiety in itself is not good for the embryos. So most clients would come and ask, okay, should we observe full or total bed rest? Now, like I said earlier, there is no scientific evidence to prove that total bed rest is necessary after embryo transfer, but she can actually observe that from the moment the embryos are transferred into the uterus to 24 hours after that. Now, she should, the client or the woman that has had her embryos transferred into her uterus, should, one, avoid trying things for the first time. So The reason why she shouldn't try things for the first time is because she is yet to ascertain, she cannot ascertain whether or not these things are going to physically and mentally exert or drain her. So the process after embryo transfer is not the period to begin to try things for the first time. Also, the client or the woman should also avoid strenuous activities that can drain her physically and mentally. Those strenuous activities like exercising. Now, she shouldn't exercise now. She shouldn't carry weights as well. Avoid weightlifting. Even if she must lift at all, she shouldn't lift things more than 10 kg. Now, and like we know, 10 kg is not so much of weight. So it's like we're just saying, please, no heavy lifting. She should avoid strenuous household chores. Strenuous household chores like cleaning, doing the laundry, grocery shopping. Cycling should also be avoided. Jumping back and forth on stairs should also be avoided. Running should also be avoided. So instead, she can opt for brisk walking, a stroll in the park, cooking. These are not physically demanding, they are not physically exerting. Now, the reason for the prevention of weightlifting, for the avoidance of weightlifting, is just because carrying weights has a way of straining, putting stress on the abdomen. It has a way of straining the abdominal cavities, and this can hinder implantation. Also, the patient can resume working during this period. She can go to work so long as her work does not involve she going back and forth on the stairs. It does not involve so much physical and mental stress. She can actually decide to resume work or go back to work. So the second point now is pelvic rest. Now, the woman should endeavor as much as possible to rest her pelvis. Now, by pelvic rest, there are some things I'm going to state here which covers the point pelvic rest. The first thing she has to avoid under pelvic rest is sexual intercourse. Now, it's just temporary anyways. Sexual intercourse, as studies have shown that sexual intercourse can trigger uterine contractions, which can prevent our embryos from implanting in our uterus. So she should just take temporary rest from sexual intercourse. And now, since we are on the issue of pelvic rest, we are on the issue of pelvis or the pelvic, I should note here that douching should also be avoided. Now, douching simply means running a stream of water into or through the vagina for either medicinal or hygienic purpose. So running a stream of water through the vagina for medical or hygienic purpose. Now, the reason for doing this is to prevent infection. That is generally the reason why we are doing this. We're trying to prevent infection. And because of this as well, the woman should avoid swimming. She should avoid swimming. She should avoid sitting in a bathtub during this period, because we do not want her to be predisposed to vaginal infections. Instead, she can take a shower or just bath. But please, she should avoid ouching, she should avoid sitting in a bathtub, she should avoid swimming at this point. So the next point is don't forget the first point I made mention of was relaxation. During this period, she should endeavor as much as possible to relax. Then after that, I made mention of the point pelvic rest. She should try as much as possible to rest her pelvis. This is not a period she wants to be engaging in sexual intercourse, because because of uterine contractions that sexual intercourse can trigger, which can prevent implantation, which can hinder implantation. So my next point is diet. the woman who has undergone the IVF process, who have had embryos transferred into her, should eat a balanced diet. Okay, so here I'm going to define what a balanced diet is. A balanced diet is just, simply put, a meal that contains and keep ourselves hydrated. So now, since we are under diet, I think the do's of the diet is to eat a balance. The don'ts of the diet are: one, she should avoid food that can predispose her to bacteria. Now, food that are raw or undercooked, raw egg, raw meat, she should avoid all of this. She should also avoid food that are preserved, processed, excessive sugar. Okay, she should stay away from all of this. She should avoid food that can cause her to constipate, because we don't want her exerting too much strain on her abdomen while straining to defecate. So meals that will cause her to constipate should be avoided. Meals that would upset her stomach should be avoided. Meals that would cause her to have an heartburn, spicy food, should also be avoided. Also, under diet, she should also avoid the intake of caffeine, alcohol, and also smoking. Now, caffeine and alcohol and smoking can also, studies have shown that they also hinder implantation, like prevent implantation from occurring. Okay, so don't forget that the goal of the post-IVF care is so that we can have, so that we can improve the woman's chances of having conception, of achieving pregnancy. Now, my fourth point after diet will be medications. So after the IVF process, the woman that has undergone the IVF process might be tempted to skip her medications. She might be tempted to forget her medications. Okay, so this is not a time to not remember to take one's medication. So after the IVF process, after embryo transfer, the woman should endeavor as much as possible to use her medications religiously and follow prescriptions, medical prescriptions, because these drugs that have been prescribed are trying to, one, keep the uterus at the optimum. They are trying to keep the uterus, like the environment of the uterus, at optimal, like at optimal. We want the embryos to implant successfully. So the medications are a kind of support. We call them luteal support. They are a kind of support to support our to enhance our chances of having a successful pregnancy. So to reduce the chances of forgetting to use one's medication, the woman should or can set alarms on her phone or keep a timer to kind of remind herself that, okay, it's time to take her medications, because these medications are actually very important. So my next point is having a positive mindset. So this is IVF process. The whole process can be emotionally draining. It can be emotionally exerting. But don't forget, during this period, we are trying to enhance the chances of having a positive pregnancy result, having a positive pregnancy. So we're trying to minimize stress. We're trying to minimize stress, reduce anxiety. As such, the woman should try as much as possible to surround herself with people that will keep her happy, with people that are going to help her have a positive mindset, help her believe that she can achieve conception, all in a bit to just keep her less anxious, reduce anxiety, and improve her chances of achieving a successful pregnancy. So now, those are the things that the woman should take note of during IVF, during post-IVF. These are the care she should undergo, she should do during the post-IVF care to enhance our chances of having a successful pregnancy. Now, let's go to the symptoms after, or symptoms that mimic early pregnancy signs. Symptoms after an embryo transfer, what to expect. So, normally, clients associate these symptoms with positive pregnancy signs, but I think it's good to actually note that most of these drugs that are taken after the IVF process, the progesterone, the estrogen, their increased intake also has a way of mimicking the early symptoms, early pregnancy symptoms. But then, these are the things to expect, these are the things that could happen, that normally happens. Light bleeding or spotting. So, we actually call this major signs if pregnancy is successful, if implantation is successful. Implantation bleeding. Now, this would be a positive sign that implantation has successfully occurred. But like I said earlier, it could actually be as a result, as a side effect of increased progesterone intake. Also, secondly, we have cramping and bloating, or cramping or bloating. So, mild abdominal cramps is usually common to this period. Now, the abdominal cramps can also be either as a result of increased progesterone intake, or it could also be implantation cramping. But mild abdominal cramp can be expected at this, like during this period. Also, there could be pelvic discomfort. So now, when the client or when the woman experiences any of this, she can go on to use acetaminophen, paracetamol, to relieve these symptoms, to relieve this pain, but not more than 2 tablets of paracetamol. So I think here I should say that she should not take any medication during this period without first consulting a physician. She should avoid non-steroidal anti-inflammatory drugs like ibuprofen, diclofenac, etc. So not more than 2 tablets of paracetamol. So the next point is bloating. Now, this is just a sense of fullness that can occur probably as a side effect of increased progesterone intake as well. And sore and painful breasts is also associated with this period. The breast may become a little painful to touch, sore to touch, tender to touch. Also, due to increased progesterone intake, the woman might feel tired. She can feel fatigued. She can feel exhausted. Now, if she experiences any of these, she can just rest it out, sleep it out. All these are they are signs and symptoms that follow the IVF process that comes post IVF. So if the woman is feeling tired and fatigued during this period, she can just rest it out and keep herself well rested. So the next thing is the next sign that accompanies, that is common to this period, is discharge. So the vaginal discharge can also be a side effect from the progesterone inserts, from inserting progesterone. So it can be a side effect from she inserting progesterone. It can also be it can be a positive sign that implantation has successfully occurred. The next point is a frequent need to urinate. So at the onset of pregnancy, now the woman's body begins to produce the hormone called, or the hormone known as human chorionic gonadotrophin hormone. So when this is secreted by her body, she might have an increased need to urinate. But then if the urination is accompanied, it would be a cause of concern for her if the urination is accompanied by probably blood, if she notices blood in urine, painful urination, pain on urination. It could be a urinary tract infection, and she would definitely need to consult a physician. Also, high body temperature. Due to the rapid hormonal changes in the body, the woman can begin to feel a surge in her body temperature, an increase in her body temperature. But then this can be a cause of concern for her if her body temperature, upon measurement using a thermometer, goes beyond 38 degrees Celsius or 100 degrees Fahrenheit. And lastly, she can feel headache. Now, the headache can also be as a result of the increased progesterone intake. It could be a sign of successful implantation. So these are the things that she can feel during this period. So thank you so much. Now I would like to take questions because of time. So please, let's just keep our questions flowing in so that I can address them before I go off. Once again, thank you for joining. So while I wait for the questions to come in, I'll just quickly do a rundown of the things that I've spoken about. So I've spoken about the care you can give to yourself, that the woman can give to herself during the post-IVF period. I've defined what IVF is, in vitro fertilization. I've defined what the care she can give to herself after the woman would say after embryo transfer, the things to expect. So I've spoken about light bleeding, cramping, bloating. Now for the light bleeding, now it will be a cause of concern if there is heavy bleeding. Now heavy bleeding in the sense that if the bleeding is capable of soaking at least one menstrual pad, then that can be quantified, that can be categorized as an heavy bleeding. So, but then if it does not soak one menstrual pad, at least one menstrual pad, it can still be regarded as light bleeding or spotting, which is not a cause for concern. Now, like I said earlier, mild cramping, mild abdominal pain is also expected, can also be seen. A sense of fullness can also be seen, and being tired, being fatigued, being exhausted can also be seen. Then is also expected. Having vaginal discharge is also expected, and also frequent need to urinate and high body temperature and headache can also be seen. So those are the things I spoke about. So now I'm still waiting for the questions to roll in. Please, can you send in your questions? We're running out of time. I'd like to address them before going off. So to the people that joined in, thank you so much for joining in. It has really been fun. It has really been exciting. Still waiting for the... Okay, so thank you so much for these questions. Marcia, thank you so much. So the question is, you're asking, you said I made mention of implantation, but you don't understand what implantation means. Okay, so when I said implant, what is implantation? Now, after the embryo has been transferred into the uterus, there is a point where the embryos, when they were attached to the walls of the uterus. Now, when they attach to the walls of the uterus, the scientific term that we call that process is called implantation. It's just the process by which it's like it can be likened to the embryo sitting comfortably in the uterus, in the walls of the uterus. So that's just the summary of what implantation means. So I hope I've been able to address that. Then the next question I'm seeing here, I am Casey. Sorry if I mispronounced that. He's asking. He said you said I heard you talk about using water. So using water in the sense, the only time when I mentioned water, if I can recall, is when I said the woman should avoid taking douching. Yeah, I remember saying the woman should avoid douching. Douching, running a stream of water, like a jet of water through the vagina for medical or hygienic purpose. Now, this is just to prevent. Oh yes, this is just to prevent infection. We're trying to prevent infection. Now, when water is run through the vagina, now we can't say the water in itself is sterile. So we're trying to minimize infection. The client does not at this period want to run water just because the water can in itself contain microorganisms that can predispose the woman to infection. Also, douching in itself removes the normal flora. There are things we call normal flora in the vagina. They are the normal flora, like they help the vagina in itself. I don't want to go into what normal flora is and all of that, but then douching in itself reduce or eradicates the normal flora in the vagina, and this can also predispose the woman to infection. So okay, so that is clear. Thank you very much. So please, can we have more questions? Because of time, I'm going off. I might have to go off now. Thank you so much. Thank you everyone that has joined in. Thank you so much. Now I'm going off. Thank you so much for joining in once again. Please remember to log in. Remember to join us next week for another episode of Fertility Focus. Thank you.